Hello, health students. Just pulling up lesson 3 of chapter 23 here, more on communicable diseases. And we got 15 minutes here that I can talk, so we'll probably get cut off towards the end. But I'll keep an eye on it here as I get going. But we're talking about fighting communicable diseases. And as you can see, I'm doing something you probably shouldn't be doing unless you're close by a sink to wash your hands or antibacterial soap. One of the things we talked about in previous lessons is do the best you can not to touch your face if you're don't have the ability to wash your hands before you do that. And it's a knee-jerk reaction that everybody has if they got an itch, if they have something in their teeth. People go right to that, but that's something that I'm going to use the word new normal, that I think people are going to have to start to learn some of these habits over time that can protect people from communicable diseases. But we'll dig into it here. By learning about practicing prevention strategies, you can help your body stay healthy for longer periods of time. And no matter what you do, there's still going to be times where you're going to get sick. You could take the most preventative measures possible, and depending on how your immune system is going to react to things, really, how strong your immune system is going to determine whether or not that pathogen enters your body. It's going to depend on how strong your immune system is and be able to fight it off before an infection takes place. So let's talk about physical and chemical barriers. These barriers make up your body's first line of defense against pathogens. So your body has its own built-in barriers to handle invasion of microscopic pathogens. And the one thing we're talking about is physical barriers first. You have to think about the areas of the body that are open or that have membranes that pathogens can pass through easily. And one of those membranes that we talked about is a mucous membrane. So let's talk about the physical barriers, such as your skin, that block pathogens from invading your body that way. If there's an opening in your skin of some sort that can be direct into the bloodstream, then we'll talk about those issues. There's problems with it. Okay, chemical barriers such as enzymes that you may have, like say for instance, you have enzymes in your tears that can destroy invaders. So yeah, they talk about eyes being a mucous membrane, but your tears do a certain amount of protection that should be able to stop or kill some of those pathogens before they get in through that mucous membrane. Okay, so again, tears and saliva contain enzymes that can disable some pathogens. Okay, so again, that's one of the reasons why there's spit and there's saliva. When you put an invader gets into your system through your mouth, there's that capability. You have to also think about cilia. I want to switch to the next one because that's what are considered small hairs. Well, think about what the reasoning is for having nose hair. Somebody might think, well, what the heck do we have nose hair for? All that does is just get in the way. Well, nose hair, think about it, it's just like any other cilia in the body. Nose hair is to protect for when you breathe through your nose so that certain things can get caught in that hair that could be considered invaders or alien to the inside of your body. So again, tears and saliva, mucous membranes, skin, cilia, and even gastric juices. So get to the point where something that you eat something that has a foodborne illness. Well, if that foodborne illness gets all the way into your stomach, you'd think, okay, well, right away that pathogen got in there, but your stomach acid does a certain amount of its job to be able to kill some of these things. That's why stomach acid is so strong, is that it's there to be able to kill other invaders to the inside of the body. Okay, the immune system, your body's immune system is the best ally in the fight against communicable disease. So some pathogens can get past your body's physical and chemical barriers, and that happens. That's why people get sick. If all these physical and chemical barriers worked every time, no one would ever get sick. The immune system fights pathogens using two major strategies. Okay, the first thing that it does is it swells. It's got inflammatory response. Okay, inflammatory response and defense, specific defense techniques that it has. The immune system. Okay, so we'll talk more about that as we move on here.
Immune system, a network of cells, tissues, organs, and chemicals that fight off pathogens.
Just looking at the time here.
Immune system.
So say for instance you get a splinter or you get a cut that becomes red and swollen. These are symptoms of inflammation or inflammatory response. So again, that's that reaction to the tissue damage caused by an injury or an infection. So when it gets red, when it gets swollen, when it starts to get fluid in it like pus, those types of things are there to protect it so those pathogens don't get deeper into the body. Okay, inflammatory response, blood vessels near the injury can expand, allow more blood flow to that area. Number two, fluid and cells from the bloodstream cause swelling and pain because of the pressure in the nerve endings. Okay, phagocytes around the pathogen destroy them with some special chemicals. Okay, and then with the pathogens killed and the tissue damage under control, the body begins to repair the tissue. So you see kind of how all of that takes place if there's a cut there. Again, we talked about pus. The pus can be something that can help, that's chemical that helps kill the bacteria around the area that's there. Mass of dead phagocytes, usually that pus starts to gather up in there and damage tissue and may build up around the site of the inflammation as a response to the bacteria. So that's what happens when the bacteria gets there. It starts to almost fill up that area to protect it from any other types of bacteria to get in or pathogens to get in.
Phagocyte, white blood cells that attack invading pathogens.
Okay, specific defenses. The immune system triggers the immune response and reaction to pathogens that survive. So there's so many things that can protect those pathogens from getting into the body and getting into the bloodstream, but there are certain amounts that do get in regardless of the defenses that we have. So the immune system recognizes a particular pathogen. It activates specific defenses in an attempt to prevent this type of infection from occurring again. So what happens is when that comes into play, your body remembers that pathogen, so that if it gets into the body again, it knows how to fight it in its best possible way. Okay, so take a peek at these slides, and there's a lot to read here, so we're not going to go through all of that. You could take a little bit of time on your own. Okay, but it just talks about pathogens invade the body. You got a couple of different things that come in here. You got the macrophages. Engulf the pathogen. The macrophages digest the pathogen. The T cells recognize the antigens and the pathogens as invaders. The T cells will bind to the antigens. The B cells bind to the antigens and the helper T cells, and the B cells divide and produce plasma cells. And those plasma cells start to release antibodies into the bloodstream. Those antibodies will bind to the antigens to help other cells identify and destroy pathogens. So basically what they're doing is they're trying to create some fighters. That's what they do. And they go out and fight some of these other pathogens to get through the body. I know I said I wasn't going to read all that, but if I go through it in that process, you might understand it a little bit more. And you're probably hearing about antibodies now. They've been talking a lot with the coronavirus about how to come up with some kind of antibody test. And what they're doing is they're trying to take plasma from people that have been infected with COVID-19 and have recovered. They try to take their plasma and use that to try and pump in some of those fighters into other people that are getting sick. They're hoping that has a response to it. During the immune response, your immune system reacts quickly to antigens.
Antigens, substances that are capable of triggering an immune response.
Okay, when you have immunity, you have a biological defense to avoid infection or disease. And I know you've probably heard a lot about immunity lately too.
Immunity, the state of being protected against a particular disease.
So there's lots of speculation on to whether or not once somebody gets a virus like COVID-19 and they've recovered from it, do they have immunity to it? Doctors are erring and scientists are erring to the answer of They think so. They think that once you have it, you have immunity because the body's immune system has done its job to fight it off. And in the process of fighting it off, it builds up and remembers how it fought it off. Okay, but that doesn't mean that somebody's going to be immune to it forever. Think about the flu and those viruses that come out. There's a vaccination every year for it, and the vaccination is different every year. They have to change certain things because those viruses mutate and they change a little bit. Okay, so those are things that we have to think about. Lymphocytes play an important role in the immune system, and there's two types of lymphocytes. There's the T cells and the B cells.
Lymphocyte, a specialized white blood cell that coordinates and performs many of the functions of specific immunity.
Okay, we're getting into about the 11-minute mark here, so I'll get cut off here at some point. But let's talk about the T cells. There's the helper T cells, the killer T cells, and the suppressor T cells. Okay, those helper T cells trigger the production of B cells and killer T cells. The killer T cells attack and destroy infected body cells, but don't attack the pathogen. And then the suppressor T cells, or turn off the helper T cells. They suppress and turn off the helper T cells when the infection has become cleared. So basically what they do is they go in and they say, okay, the job of the trigger the production of the B cells and the killer T cells, the suppressor says, okay, the pathogen is under control, you guys can take a break now. So it's almost like a bunch of soldiers that go into battle to start fighting, and the suppressor T cells is like the commander or the general that says, okay, you guys can back off now, go take a breather, we've got this under control. Okay. Each B cell is programmed to make up one type of antibody that's specific to certain pathogens.
Antibody, a protein that acts against a specific antigen.
Okay, antibodies perform the following functions: attach to antigens to mark them for destruction, destroy invading pathogens, and block viruses from entering the body's cells. Okay, again, we talked about how the body remembers, or the immune system remembers. Immune system memory. Your immune system remembers the antigens it has dealt with in the past. When antigens activate certain T cells and B cells, the cells become memory lymphocytes, so they remember. Okay, and this is kind of it just goes through the lymphatic system, the immune system, and how it works. So you could take a little bit of time to read through the lymphatic system, talk about what the lymph nodes do and what the lymphocytes do. Your immune system's memory not only identifies invading pathogens, it also helps you develop immunity to certain diseases. Okay, there's two types of immunity: active immunity and passive immunity. And I hope I have enough time to talk about this. I don't think that I do, but let me try to give you a little bit more. Your body develops natural active immunity when it's exposed to the invaders. Artificial immunity, artificially acquired active immunity is a vaccine. So an active immunity is when you actually catch the disease and your body does the job to fight it off itself. If it's artificially acquired, that means you got the vaccination. They actually gave you the disease, but in the process, they gave you the fighting antibodies in there as well so that they learn how to fight it off.
Vaccine, a preparation of dead or weakened pathogens that are introduced into the body to stimulate an immune response.
Okay, for some diseases, you only need the vaccine once in your life, but for other diseases, you need to be vaccinated at regular intervals, and that's how we talked about going through how many different types of vaccinations that are out there. With the flu, it changes about every year. Okay, but passive immunity is temporary, usually lasting only a few weeks or a few months. Natural passive immunity occurs when antibodies pass from mother to child, so that's one way, during pregnancy or while nursing. And then artificial passive immunity happens when you receive an injection prepared with antibodies. Okay. So I'll let you look at some of the prevention strategies here. I know I'm going to run out of time. I've got about 20 seconds before this thing's going to kick me out, but I want you to take a peek at about the last 4 or 5 slides here. It's going to talk about prevention strategies and preventing the spread of disease.